Could you please explain what a deep pelvic ultrasound scan is?
Yes, so deep pelvic scanning is the most comprehensive ultrasound scanning, which is indicated in patients when we suspect there is a deep infiltrating endometriosis or adenomyosis or any uterine pathologies like fibroids or endometrial polyps, which needs more thorough examination. So the difference in deep pelvic scanning, first it's done by expert sonographers. Usually they are gynecologists or very experienced sonographers with training and specialization for endometriosis ultrasound scan and adenomyosis ultrasound scan. This is first requirement. Second is usually these scans are done in specialized tertiary level imaging centers. So you may have a simple radiology centers, so where the scans are gynecological or baseline ultrasound scan for fertility can be done by the radiologist. They're not quite specialized in one area. They can do generalist ultrasound scanning, but deep pelvic scanning is done at tertiary level scan sonographers or gynecologists with expertise in diagnosing of deep pelvic ultrasound, deep pelvic endometriosis and adenomyosis and other uterine pathologies or gynecological pathologies. So also usually they use, generally they use much more powerful machines, and they do 3D scanning as well. So that's very, very comprehensive, thorough ultrasound scanning. This is one requirement. And also deep pelvic ultrasound scanning uses criteria called MUSA criteria for assessment of uterus. For assessment of ovaries, they do thorough scanning, antral follicle count is included. If there's any uterine ovarian pathology, that's scanned. And let us say you have ovarian cyst, then they describe the nature of the cyst. Is it looking like hemorrhagic cyst, endometriotic cyst, or dermoid cyst, or is it looking more sinister cyst, which is very, very rare in women undergoing fertility treatment, but it may happen. So they give a very good description of ovaries, and also you have a very detailed description of uterine anatomy as a part of MUSA criteria, which we can discuss later. So, and here the purpose is to rule out adenomyosis, which is not easy diagnosis to make, especially if it's very early adenomyosis, deep pelvic deep endometriosis, and any ovarian pathology. So, and the simple scanning, simple gynecological scanning or fertility scanning, you may not be able to diagnose deep infiltrating endometriosis, but in deep pelvic scanning, it can be diagnosed. There are certain features, like for example, if you have a pelvic adhesions because of endometriosis, if you have endometriotic nodules infiltrating to the bowel or bladder or uterus, in deep pelvic scanning, you can detect, and it's not as sensitive diagnostic as laparoscopy, but the level before doing laparoscopy, you can do deep pelvic scanning to rule out deep infiltrating endometriosis.